Hello everyone, welcome to BMS with me. Today let's learn one of the important topic that is abortion. 90% of hemorrhage in early pregnancy is due to abortion. It is also called as spontaneous abortion or miscarriage. Definition: abortion is the expulsion or extraction from its mother of an embryo or fetus weighing 500 gram or less when it is not capable of independent survival given by World Health Organization. 500 gram of fetal development is attained approximately at 22 weeks of gestation. What are the incidences of abortion? 75% of abortions occur before the 16th week and the 75% occur before the 8th week of pregnancy. Now coming to classification of the abortion, it is divided mainly into two types, that is spontaneous abortion and induced abortion. Spontaneous abortion, it is divided into isolated and recurrent, and both are of five types, that is threatened, inevitable, complete, incomplete, missed and septic. Six types. Now coming to induced abortion, they are of two types, that is legal and illegal. Illegal, it is septic abortion is common in illegal abortion. Coming to the etiology or cause of abortion, the etiology of miscarriage is often complex and obscure. They may be due to genetic factors, endocrine and metabolic factors, anatomical abnormalities, infection, immunological, and others. Let's look at one by one. Genetic factors: 50% of abortions are caused due to chromosomal abnormality in the conceptors. Numerical defects of chromosomes like trisomy, polyploidy, monosomy, structural chromosomal rearrangements, etc. These are running over the genetic factors. Coming to endocrine and metabolic factors, they cause about 10 to 15% of the abortions are due to endocrine and metabolic factors. Luteal phase defect results in miscarriage as implantation and placentation are not supported adequately. Deficient progesterone secretion, thyroid abnormalities, diabetes mellitus, these are all responsible for the abortion. Third is anatomical abnormalities. They also contribute 10 to 15%, like cervical incompetence, congenital malformation of the uterus, uterine fibroid, intrauterine adhesions, etc. Coming to infections, viral infections like rubella, variola, cytomegalovirus, etc. Now coming to parasitic infections like toxoplasm, malaria, etc. and bacterial infections like ureaplasma, brucella, etc. Coming to immunological disorders, they also contribute 5 to 10% of the miscarriage, mainly due to autoimmune and alloimmune factors causes for the abortion. What is autoimmune disease? These patients form antibodies against their own tissue and placenta. Alloimmune disease, it is the paternal antigens which are foreign to the mother invoke a protective blocking antibody response. These blocking antibodies prevent maternal immune cells from recognizing the fetus as a foreign entity. Therefore, the fetal allograft containing foreign paternal antigens are not rejected by the mother. Paternal human leukocyte antigen sharing with the mother leads to diminished fetal maternal immunologic interaction, and ultimately there will be a fetal rejection. Now coming to the sixth one, that is others which are responsible for the miscarriage, like blood group incompatibility, premature rupture of the membranes, etc. Now coming to the classification of abortion. First one is threatened miscarriage. Definition: it is a clinical entity where the process of miscarriage has started but not progressed to a state from which recovery is impossible. Here, miscarriage process has started but it has not reached to the stage from where recovery is impossible. Vaginal bleeding during early pregnancy without, here we can see the vaginal bleeding during early pregnancy without cervical dilation. What are the clinical features of threatened miscarriage? First is bleeding per vagina, usually slight and bright red in color. Rarely bleeding may be brisk and sharp, especially in the late second trimester. Bleeding usually stops spontaneously. Second is pain. Pain appears usually following the hemorrhage. Bleeding usually is painless, but there may be a mild backache or dull pain in the lower abdomen. Coming to the examinations, there are two types of examinations here, that is pelvic examination and digital examination. Pelvic examination, it should be done as gently as possible. Digital examination, it reveals closed external OS and there will be a uterus and cervix feels soft. What are the investigations of threatened miscarriage? First is complete blood count for hemoglobin and hematocrit. Second is urine examination should be done. Third is ultrasonography, especially transvaginal sonography. What are the findings of the investigation? A well-formed gestation ring with central echoes from the embryo indicating the healthy fetus. There will be an observation of fetal cardiac motion. Third, a blighted ovum is evidenced by loss of gestation. What are the treatment for threatened abortion? First is rest. Patient should be in bed for few days until the bleeding stops. Second is drugs, sedation and relief of pain. Drugs like phenobarbital 30 mg, diazepam 5 mg. Prognosis. In isolated spontaneous threatened miscarriage, the following events may occur. That is, first is in about 2/3 the pregnancy continues beyond 28 weeks. Second is if the pregnancy continues, there is increased frequency of preterm labor, placenta previa, intrauterine growth restriction of the fetus, and fetal abortion is inevitable abortion. It is a clinical entity where changes have progressed to a state from where continuation of pregnancy is impossible. Here, the cervix has been dilated but without expulsion. What are the clinical features? First is increased vaginal bleeding. Second is aggravation of pain in lower abdomen which may be colic in nature. Third is internal examination reveals dilated internal os of the cervix through which the product of conception are felt. What are the ways to manage the inevitable abortion? That is to accelerate the process of expulsion. Second is to maintain asepsis in conduction of the labor. General measures. Excessive bleeding is promptly controlled by administering methargine 0.2 mg if the cervix is dilated and the size of the uterus is less than 12 weeks. Second is blood loss is corrected by intravenous fluid therapy and blood transfusion. The active treatment, that is first one before 12 weeks, dilation and evacuation followed by curettage. And second is after 12 weeks, the uterine contraction is accelerated by oxytocin drip 40 to 60 drops per minute. If the fetus is expelled and the placenta is retained, it is removed by ovum forceps. If lying, separated. If the placenta is not separated, digital separation followed by its evacuation is to be done under the general anesthesia. If bleeding profuse with cervix is closed, evacuation of uterus by abdominal hysterectomy. Thank you.